Hello everyone, my name is Poonam Muzmule. I am the student of Bristol Institute. Today's topic is on blood pressure. Blood pressure it is the measure of force exerted by circulating blood against the walls of the artery. It is essential indicator of cardiovascular health and crucial ensuring that the body's organ and tissue receiving the enough oxygen and nutrient. Mm, the blood pressure is uh, there are there are two. There is a systolic pressure. In this systolic pressure, this is a pressure when arteries vein heart contract and pump the blood. It is typically a higher of two number, and it reflects how much pressure is exerted when heart is actively pumping the blood. So next it is a normal systolic pressure is usually less than 120 mmHg. When it's higher, it indicates that risk of the heart diseases and stroke. Next it is a diastolic pressure. This is the pressure in arteries when heart is the rest between the beat and allowing it to refill with blood. This number measures the baseline pressure within the arteries. Then next it is a normal diastolic. Normal diastolic pressure is typically less than 80 mmHg. Um, Blood pressure categories. First, it is normal blood pressure less than 120 by 80 mmHg. This is the ideal range of blood pressure, and it indicating the healthy heart and blood vessel function. It is elevate the blood pressure 120 to less than 80 mmHg. At this stage, blood is higher than normal, but not it in the hypertensive range. So this state may increase the risk of developing hypertension unless preventive action like lifestyle changes are taken. So hypertension stage 1, in this 130 to 80 mmHg, it is a risk of heart diseases, stroke and other complication, and medical advices is typically recommended to control the blood pressure through a lifestyle changes, medication. Hypertension stage 2, in this 140 or higher blood pressure. This is a more severe stage of high blood pressure. It requires a medical intervention and including medication. It also it help to reduce the risk of the heart diseases, kidney damages, and other complication. Then next is a hypertensive crisis. In this higher than 180 mmHg. This is an emergency situation that require immediate medical attention. It can be lead the life threatening such as stroke, heart attack, and kidney failure. Next it is the importance of blood pressure regulation is to maintain a normal blood pressure is critical for cardiovascular health. High blood pressure is often referred to as silent killer because it can damage the arteries, heart, and kidneys without noticeable symptom when until it's severe damage. So reduce the risk of stroke and heart attack. High blood pressure can lead to atherosclerosis. It means narrowing and hardening the arteries, and increasing the likelihood of strokes and heart attack. Um, Kidney function. High blood pressure can damage the kidney over the time and impairing the ability to filter the waste from blood. So next it is the eye health. Uncontrolled high blood pressure can cause so damage of blood vessels in the eyes and leading to vision problem. Causes of high blood pressure. It hypertension. Several factors can contribute to high blood pressure, um, including the genetics. Sometimes family history or high blood pressure increases the risk. The factor it is age. The risk of high blood pressure increases with age. Next factor it is obesity. Being overweight put an extra strain on the heart and leading to higher blood pressure. So next it is a physical inactivity. Lack of exercise can contribute to weight gain and high blood pressure. So next is a poor diet. Diet high in salt, fat, cholesterol can raise the blood pressure. Next it is a stress. Chronic stress can lead to temporary spikes in blood pressure. Smoking and excessive alcohol use, both habits are linked to high blood pressure and heart disease risk. Causes of low blood pressure, it means it also known as hypotension. So low blood pressure or hypotension can also be a concern, and it occur when blood pressure is falls below the normal range, and leading to symptoms like dizziness, fainting, and shock in severe cases. And possible causes include, first is dehydration. It lead to weakness, dizziness, and fainting. Next is the heart condition. Certain heart problem can lead to blood pressure, such as very low heart rate. It is known as bradycardia or heart valve problem. Next it is endocrine problem. Hormonal issue such as thyroid problem can also affect the blood pressure. Blood Next factor is blood loss. Significant blood loss from injury or internal bleeding reduce the amount of blood in the body, and leading to low blood pressure. Next it is a infection. Severe infection can lead to sepsis and causing the dangerous drop in blood pressure. So to maintain a healthy blood pressure, it require a healthy diet. Eating a balanced diet that is low in sodium, rich in food and vegetable. It include a healthy fat, can help keep the blood pressure under control. Next is exercise. Regular physical activity strain the heart, helping it pump the blood more effectively, and reducing pressure on the arteries. Then next is weight management. Maintaining the healthy weight reduces the strain of the heart and the blood vessel. Then next is limiting alcohol and quitting smoking. Both can raise the blood pressure and increase the risk of heart diseases. Next it is stress management. Practicing and relaxation technique such as deep breathing, meditation, yoga, it can help reduce the stress and maintain the healthy blood pressure. Then next is monitoring the blood pressure. Regularly monitoring the blood pressure is essential, especially for individual at a risk of hypertension. So it can be done at a healthcare facility or at a home, and reliable digital blood pressure monitor. So early detection of high blood pressure, and it allows and timely to prevent a long term complication. So managing the blood pressure through lifestyle changes or medication when necessary, um, the individual can significantly reduce the risk of the cardiovascular and kidney diseases, and improve the quality of life, and increase the life expectancy. So it's all about. Thank you.